is. But I did want to talk about all of the potential non-cosmetic plastic surgeries that are out there, and that's me about to do one. And I think a lot of people don't realize how broad plastic surgery is. And so I want to talk about what all plastic surgeons do and also why people may or may not do the things they do in their practice. So of course there's reconstruction. We talk about that a lot. You know, there's breast reconstruction. I do a little bit of that in my career. At one point I did an insane amount of that.
Yeah.
There is wound reconstruction, which I do a lot of that now, working at the Horizon Medical Center. There's trauma reconstruction, so I still do that as well. A lot of facial injuries because, you know, as plastic surgeons, we're expected to get the best outcomes for closures, and so when children get injured or, you know, young people get injured in the face, a lot of times we're called in to close that, even if it's something that the average doctor might be able to close. They rely on us to get, you know, a higher level of result. Burns. I did tons of burn surgery when I was younger. I did 5 years of burn surgery in Kentucky and 2 in Tennessee. It's interesting stuff. Maybe not my favorite thing to do because it's sad. You know, a lot of really badly burned people that have very drawn out recoveries. And of course, people do die in that. And so definitely not as chipper as some of the things I do these days.
Yeah.
But it is something that I did a lot of in the past. Pediatric issues, you know, a lot of people don't think about that, but, you know, cleft lips and cleft palates, which are...
I was just about to ask about that.
Yeah, very prevalent. Also craniosynostosis, which is when the skull fuses abnormally. I don't know if you've ever seen, you know, the medical oddities picture of the kid with a weird shaped head. You know, that's generally due to the suture lines of the skull closing too soon, and then the skull can't expand. And actually can cause children, you know, severe problems. So both of those cleft lip, cleft palate, and craniosynostosis surgeries would be done by craniofacial surgeons. You know, I fellowship. So with plastic surgeons, you can just be a general plastic surgeon, totally fine, do a little bit of everything, or you can be a specialist. I did a fellowship in cosmetic breast and body. There are fellowships in craniofacial, and so although I could do a cleft lip or cleft palate if somebody forced me to do that, I don't, because there are specialists out there that do them, and of course the way the referral patterns go, they generally get referred by pediatric hospitals, and they have people on staff to do them. But that is a side of plastic surgery that, you know, a lot of people don't realize that's out there. Skin cancers and facial lesions and skin lesions on the face. I do a lot of that stuff, you know. People get skin cancers on the nose, and, you know, it's actually kind of tricky to remove a cancer on the nose and close it up and make people look normal. But that's definitely something that's in our arsenal to do. And I kind of like those cases, you know. They're ones that make you think, and that's one of the reasons I really like plastic surgery in general, is it's a lot of thinking, you know. With general surgery, you know, you make your diagnosis, and, okay, surgery's step 1, step 2, step 3. Plastics, you know, there might be multiple different answers.
Yeah.
So I like that. So non-cancer breast issues, breast reductions would be the big one.
Yeah.
Unfortunately, breast reductions have gone these days to being a cosmetic surgery, not because plastic surgeons are insisting upon it, but just because the insurance won't cover them anymore, which is sad. I built my practice doing breast reductions kind of a little before I started really doing a lot of the breast reconstruction. And, you know, it's something that really helps patients, and it's sad that the insurance companies have kind of cut that out.
Yeah, I feel like that would be something like a preventative measure, almost for like back problems.
You would think that, but
mental
you know,
health.
Insurance companies would disagree with you. Some of them say that they still will cover it, but in reality, it's got to the point where it's pretty much impossible. They put such heavy restrictions on what you have to do to get it covered that most patients...
And it impedes with a lot of stuff. We've
totally.
talked about it before.
Yeah, absolutely.
But, I mean, exercise, your mental health, and then obviously, you know, your back.
Yeah. I mean, there's a lot of things that pop up when the breasts are too large. So, hand surgery. Not a lot of people realize that hand surgery is a part of plastics, and I still do a lot of hand. I say a lot. I take call at the trauma hospital for hand. When I first came into the area, there wasn't a hand surgeon, so I actually did a lot of elective hand, like carpal tunnels and trigger fingers, things like that. And occasionally I'll get those, but now that there's dedicated hand surgeons in town, I don't as much, which, I mean, is fine. I like the cases, but, you know, it's not that I can't do without them. And lastly would be gender transition surgeries, a newer thing.
Yep.
That Is definitely, I mean, there's some cosmetic related to that because you want to get an outcome that's aesthetically pleasing, but it's not the typical cosmetic surgery, that most plastic surgeons are doing.
Right.
And not all plastic surgeons do it. I mean, some people have, moral, I guess, objections to it. I do them for adults. I just do the top parts. I don't do the bottom. But there are a lot of things out there that are insurance-based and non-cosmetic that plastic surgeons can do. You do tend to see a trend of plastic surgeons going towards cosmetic, and so it's like, well, why is that? I mean, it's multifactorial. I mean, I hate to say it, but a lot of it does boil down to money. I've seen in the 13 years I've been in practice that the reimbursements from insurance have just shrank tremendously. Which, I mean, you're a business owner, right? So how do you run a business when your overhead goes up every year, but your income goes down? I mean, eventually you get to a point where it's just non-sustainable. And I think that's why a lot of private practice guys like myself really rely heavy on the cosmetic. Now, if you work for a university and you're drawing a salary for them, then it's a wash, because at the end of the day, the university just wants you to provide services. And they're not necessarily concerned if you make as much money as your salary make as much an insurance reimbursement as your salary is, because you're doing other things. You're writing papers, you're training residents, and so your job is considered to be more multifactorial. Well, for private guys, I mean, it's not the case. I mean, we make what we collect. And so it's pretty sad, honestly, because it does affect the number of surgeons willing to do those things. And there are things I've had to cut out because I just physically can't do them and make enough money to pay my overhead. I was mentioning the other day on this show that, at this point in my practice, at least as far as income goes, like over 90% is from like cosmetic stuff, which is crazy because my time spent is probably 50-50, Although I do a lot of cosmetic surgery, I still do insurance, and that takes up a lot of time, but the amount of money I get for it is a fraction of what I get for the other stuff. Yeah, it's really a bummer. Dealing with insurance is another one. I mean, there's a lot of resources that going into dealing with insurance and fighting to get cases covered and, fighting when they don't want to pay. And so, I get it. Like, it wears you out, and I can see how a lot of surgeons would, not want to, be involved with that. There's also the fact that these surgeries do carry higher risks and more complications. I mean, to be frank, like cosmetic surgery is generally fairly easy. I mean, there's an artistic side to it, which can be very hard for some people, but if you have that artistic ability to, create something that's aesthetically pleasing, the actual surgeries themselves are not ones that carry high complication rates, provided that you're not doing wild stuff.
And you're not like from Florida or something.
Right, yeah, you're not in Florida doing 15 surgeries at once.
Trying to kill somebody.
On somebody under local. Yeah, we've talked about that. But yeah, I just, I think it's an interesting topic because a lot of people, see plastic surgeon, they think, all they do is like breast augmentations, liposuction. And, there are people out there like that. And truth be told, I do a lot of that stuff. But I still do quite a bit of like non-cosmetic stuff. But it's just sad how little it pays. I mean, I really couldn't do any more of it because, at the end of the day, I have to make X amount of money to keep my business open.